Guys, today we're going to take a look at back leg efficiency in hitting and throwing. So this is true of baseball and softball. The more efficient my back leg can be in getting into a good position, the more power I'm going to have at hitting a line drive, driving a home run, pretty much sending the ball anywhere I want to, and the more power I'm going to have in throwing. So let's look at what that position is. When I'm hitting, what I'm talking about is that knee inside of my pelvis position so that I can drive through and use my hips on the swing. That doesn't mean spinning my foot around and squashing that bug. That means knee drive inside of my pelvis, drive through the ball on the hit. If we look at throwing, it's the same thing. As I come back and I look at load to throw, if my knee is inside of that pelvis, it turns on a huge allotment of hip muscles so that I'm here and I can drive the throw. So truly, my throwing and my hitting starts from the bottom up. And the more I can efficiently wind up this system, the further I'm going to be able to hit the ball and the harder and further I'm going to be able to throw the ball. So how does this work? If we look at my pelvis, what I'm looking for is, can my femur or can my thigh bone get inside of my pelvis, both sliding sideways and rotating in just a little bit, right? That position works because a majority of my hip muscles, your glute, your psoas, your quadratus, these great big powerful butt muscles are attached to the bone to function best with rotation. And so what we're trying to do when we drop that we drop that femur in and we rotate just a little bit is I'm trying to put all of those muscles on stretch. When I put them on stretch, it's like a giant rubber band. I pull the rubber band really hard, boom, it explodes. When it explodes, it's exploding into a great hip. Then I'm driving through my hip. It's exploding into a great throw where I'm driving through my hip for the throw. So if we're going to get our lower body involved, the first step in achieving that is getting that femur inside of my pelvis. This is not as easy as it sounds. Just drop your knee. Okay, so there's a problem with that. I have at least 50 to 60% of the athletes I have physically cannot get their femur there. So, as a coach, when you go out to the field and you're like, okay, use your hips, use your hips, use your hips, they may completely understand what you want them to do, but physically cannot get into that position because their bodies won't let them. So, your body doesn't let them because of how you spend your day and potentially how you train. If you look at what happens when I do this, I have to have enough mobility so that my femur can slide inside of my pelvis and it can internally rotate a little bit on my pelvis. So from a flexibility standpoint, TFL, IT band, glute, even lateral hamstring, all of those muscles have to be able to be long and strong for me to get to that position. We lose that mobility when we sit a lot because when I sit, my knee typically sits outside of my hip, okay? We tend to sit a little wider. We don't sit super narrow or with that knee across my body. So we get some adaptive shortening in that hip. Then you add to that the way we train. So if you're somebody who does a great deal of resisted squatting, especially if we do Olympic lifting, or we do a lot of the very common monster walk where I'm here, what happens is your body really uses the outside of that hip and we lose the ability to control femur coming inside of pelvis. So basically what happens is I get too good at using this. If I squat, especially if I'm looking at depth squat, when I squat, if my job is to keep my knee here or even to let it come wider, the outside of my hip gets really strong and the outside of my hip gets potentially less mobile. That makes it harder for my body to cross midline, meaning my knee to get across my belly button, whether I'm walking or running or whether I'm trying to get that knee inside of my pelvis to be able to drive and use my lower body. So I have to actually go after and improve the mobility there if I expect my athletes to be able to get here to pop when I'm gonna hit the ball or when I'm gonna throw the ball. So the first thing you need to do is check and see if they can even get there. So if I'm standing in my batter stance or whatever, batting or throwing, if I'm here, can they drop that knee without spinning their toe? And then can they drop that knee and does it hurt anywhere? So if you have a big restriction here, if you have a restriction in your ankle, your knee will try to make up for that, and what will happen is the athlete will complain of a lot of medial joint line or inside of your knee stress. We don't want that, right? Because what can happen is that can lead to a meniscus tear, that can lead to a labrum tear, and that can lead to back pain as my body tries to figure out how can I get here and do what they want me to do. So for me to get to this position, I have to be able to drive into my big toe. So if I can get the athlete here, big toe, I want you to drop your weight into your big toe. So it should be a connection from big toe to inside of my knee. The minute that big toe gets down, you're now turning on a truckload of hip. For some athletes, it may be really, really hard to do that. If they can't do it in a static position, meaning, can I get here, push that big toe down, not spit it out and squish the bug, drive that big toe into the floor to drop that knee. Can I get into that position? Does it hurt beyond muscle fatigue at my hip, at my knee, or at my foot? If the answer to all those things is no, fantastic. We can start motor training by just dropping to my big toe, dropping to my big toe, dropping to my big toe. If this alone is a really hard thing to do, we need to take a look at the shape of their feet. Some people simply have either foot mobility or the shape of their foot where it's really, really hard to get my big toe on the ground. If it's really, really hard to get your big toe on the ground because of your structure, this is gonna be really, really hard to do efficiently, and it's gonna create issues at hip, or it's gonna create issues with, I'm so flipping frustrated because coach, I cannot get where you want me to be because the structure of my foot does not let me get there. So you have to be aware of, is it simply a motor planning, meaning they've never been there and they're not sure how to get there, and it's a motor planning issue because we spend so much time wide that now I'm asking you to get inside, which is hard to do. Or is it a mobility issue, meaning I don't have enough mobility in the outside of my hip? So I start out in a static position, I drop. Can I get here without spinning my foot? If I understand what you want me to do and I can kind of get there, but it looks really ugly, now let's look at mobility. So there is a two-part stretch that I can do that makes this better. It makes it better and frees it up so that you can get there, and quite frankly, as an athlete, if you play softball, if you play baseball, if you play soccer, if you play football, if I have a sport where my knee has to be inside of my pelvis to create power, this is a stretch you best be doing every single day, and this is a stretch you better do before you play for sure. And if you're somebody who does a lot of Olympic lifting, especially more depth squatting, this should be a stretch you should add into your repertoire just to sort of undo some of the tightness you can get from trying to be so strong and so wide. So what we need is a step. This one is about 6 inches tall. It can be less than that, it can be more than that. What we're looking for is a stretch that you feel anywhere from the front of my pelvis, wraps around clear to the back side of my pelvis. I am gonna leave my inside foot down. I am gonna take a step across. Now, here's where you can also find out what's going on at their feet. When I'm here and I step across, I should be able to keep my big toe on the ground. In fact, I can practice from this position. It's hard to see. See how my knee is wiggling? All I'm doing is driving my big toe to the ground, driving my big toe to the ground, driving my big toe to the ground. My right butt cheek, after 5 reps of that, is on fire right now because your glute helps control that big toe motion. However, the flip side is also true. That big toe motion puts my butt on stretch so that now I can explode out of that. That connection between butt and big toe is huge. If you work on that in all of sports, you'll be phenomenal. So, can I keep my big toe on the floor with my body with stepped across? Now, hands up over my head, I'm gonna tip away from the step, tip away from the step, tip away from the step. What I am trying to do is tip my pelvis to the side, not just my low back. So if you need to put your hands on your pelvis, I'm attempting to take this guy in space, lock out this leg, and tip around him to help open up the outside of my hip. So I need to open it up in the frontal plane, meaning side to side, and then I need to open it up rotationally. So now, in this same position, okay, now I'm gonna rotate to the right, trying to keep my big toe down still. So pelvis rotates to the right, rotates to the right, rotates to the right, rotates to the right. Again, this needs to be pelvis rotating on femur to the right, not just swiveling through my low back. Ladies, this is going to be harder for us because if I don't have good hip mobility, what happens is I will swivel through my low back because we have just lots of low back mobility. So you really have to focus on taking my belly button or taking that pelvis around the corner to stretch out that hip. Now, with that being said, when I do that cross step rotation, I feel the stretch right here. I feel a stretch. I don't feel a pinch. I don't have pain. I feel a stretch. If you have pain in your low back, stop. If you have pain in your knee, stop. If you can't even manage to keep your foot on the ground in that position, stop, okay? That means we've got potentially multiple restrictions that are limiting you, whether it's a soft tissue restriction or I'm not strong enough to manage the position, but you've got stuff going on that needs assessed. But that's also kind of good news because if you're an athlete that's having a hard time getting to this position and you keep getting told, use your hips, use your hips, use your hips, drive your low body, drive, you can't. So it is not your fault. Mentally you may get it, physically your body won't let you. So that little stretch can be a great mobilizer to help you get into that position, but it can also be a great diagnostic tool as to why you can't get there. So, that's a lot, right? The moral of the story with all of this is that stretch and simply static, can I get there without pain or restriction, is gonna go a long ways towards helping you get there with hitting, get there with throwing, but if you're having a hard time with that position, this can be a little bit diagnostic for you. And if you're truly still having problems or still not able to get there and you have some questions, please message me and let me know. But in the off season, let's get going on this stretch, which will help open that up for you and help decrease your risk for knee injury, back injury, or hip injury during the season.